Hello, my name is Peter Lawrence, and I'm pleased to introduce the March issue of the Journal of Vascular Surgery, Venous and Lymphatic Disorders, as well as to highlight 4 outstanding papers which are freely available for the next 2 months. The first article highlighted in this issue is called Technical Success and Short-Term Outcomes After Treatment of Lower Extremity Deep Vein Thrombosis with the ClotTrieverÂ System, a preliminary experience, by Betteroff, Gamble, and co-authors from Emory University. They report on 12 patients who developed symptoms from acute or recurrent iliofemoral DVT and were treated using a recently FDA-approved clot retrieval device. One patient presented with phlegmasia cerulidolens, with the remaining patients presenting with disabling pain and swelling. Access was obtained in the prone position via the popliteal vein or small saphenous vein. Lytic therapy was not used in any case. Complete clot evacuation was obtained in all patients in a single session without repeat interventions. There was symptom resolution prior to discharge in 100% of the cases, and no incidence of postoperative anemia or acute kidney failure. At early follow-up, 92% of the patients continued to report significant symptom resolution, while 20% developed recurrent DVT on follow-up duplex ultrasound. The thrombectomy system was safe and effective in removing large volumes of acute thrombus in a single session, without the need for lytic therapy, intensive care unit admission, or repeat intervention. Readers may earn CME credit for our next highlighted article, which is also the editor's choice, entitled Laser Ablation versus Mechanochemical Ablation in the Treatment of Primary Varicose Veins, a randomized clinical trial by Taufik and co-authors from Egypt. They performed a prospective randomized trial on 100 patients to compare standard EVLA with a new mechanochemical procedure called phlebogriff. The authors reported a 100% closure rate with each device, but the MOCA procedure was performed more rapidly and with a lower incidence of superficial phlebitis and more rapid return to work. There were several limitations in this study since some patients had concomitant sclerotherapy as well as treatment of small saphenous veins and anterior accessory saphenous veins, in addition to great saphenous vein ablation. So further studies with other ablation devices will be required to compare outcomes in multiple superficial truncal veins and also provide long-term outcomes with phlebogriff. The third article by Lim and co-authors from Guy's and St. Thomas Hospitals in London, the United Kingdom, is called Patient Radiation Exposure for Endovenous Deep Venous Interventions. It addressed the total patient exposure to radiation from pre-op CT imaging, endovenous procedures, and postoperative follow-up and procedures. 206 patients had deep vein thrombosis and May-Thurner syndrome, including treatment with lysis, stenting, and vena cava reconstruction. They found that the combined pre, intra, and postoperative procedure radiation cumulative exposure dose product, or DAP, for DVT thrombolysis was 9.2 for lower extremities. For unilateral chronic iliofemoral venous stenting and endovenous and inferior vena cava reconstruction, the median cumulative DAP was 32, and it was 68 respectively. Although there was a great range of radiation, the authors concluded that the mean patient doses for deep venous interventions are comparable or less than most endovascular arterial procedures. The final article highlighted this month is Midterm Outcomes in Postpartum Women Following Endovenous Treatment for Acute Iliofemoral Deep Vein Thrombosis by Lestak and co-authors from King's Hospital and St. Thomas Hospital in London. They reported on the outcomes of interventional treatment for acute iliofemoral DVT in postpartum women who had a median age of 28 years and who had interventions at a median of 3 weeks post-birth. No major or minor complications were reported in any patients. The cumulative patency at 1 year was 64% in postpartum women, compared to 93% in non-postpartum women, but there was no difference in primary and primary assisted patency. However, 55% of patients required reintervention for rethrombosis, which was unsuccessful in all patients with 100% vessel reocclusion, but successful in patients with partial occlusion. Reocclusion occurred when clot was not fully lysed and stented beyond residual disease at the initial procedure. The authors concluded that initial complete lysis and adequate stenting is essential to prevent reocclusion, for which reintervention carries a low likelihood of success. Thank you for watching. For more information, please follow us on social media and remember to like, comment, and share. We hope you enjoy these 4 highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery, Venous and Lymphatic Disorders. Remember that these articles are free to read until the end of May. And thank you for your attention.